So this study evaluates RAD1901, which is an oral selective estrogen receptor degrader. This study looked at the safety and tolerability as well as the efficacy of RAD1901 in patients with hormone receptor positive metastatic breast cancer. This was a phase 1 trial which looked at different doses of RAD1901 in patients with ER-positive metastatic breast cancer. In the phase 1 trial, the study looked at different doses of RAD1901. This was a heavily pretreated population. The median number of prior therapies were 3. Almost 50% of patients had received prior CDK4/6 inhibitors or had received prior fulvestrant, which is another estrogen receptor degrader. So this was a study population that was heavily pretreated, had received prior endocrine therapies as well as CDK4/6 inhibitors. And in this population, we observed partial responses, 2 partial responses in patients with ER-positive metastatic breast cancer. We also looked at the presence of estrogen receptor mutations or ESR1 mutations. And approximately 50% of patients had ESR1 mutations that were detected in the blood, and the partial responses were seen in patients who had estrogen receptor mutations that was detected. And preliminary analysis shows that with the use of this drug, you have a decrease in the ESR1 mutations by circulating tumor DNA analysis. In terms of safety, the major adverse event that was noted with this drug was nausea as well as gastroesophageal reflux. So in summary, this is an oral selective estrogen receptor degrader which has encouraging evidence of clinical activity in metastatic ER-positive HER2-negative breast cancer, including patients who were pre-treated with fulvestrant and CDK4/6 inhibitors. The safety profile is acceptable, with the major side effect being gastrointestinal with reflux as well as nausea.